Thank you, Madam Chair. Move to strike the last word. I also want to thank my colleague, Buddy Carter, for his support as lead Republican on the Blocking Act. I think this bill shows the bipartisan work we can get done in reducing prescription drug costs. Bringing generic drugs to markets faster has been a goal of mine for a number of years. I partnered in the last Congress with another friend and colleague, Gus Bilrakis, on just such legislation. Generic drugs save patients tens of billions of dollars every single year. The more competition we have in the generic drug space, the more savings we see. That's why we provide first generic manufacturers 180 days of exclusivity on the market for being the first to file generic drug and challenge weak patents of their brand competitors. We want to create incentives to come to market and bring down these costs. But what we've seen is that some manufacturers hold on to that exclusivity and don't bring their drug to the marketplace, blocking all other generic competition. According to Secretary Azar, this happens, as was indicated, 5 times a year, and the delays are an average of 12 months longer. That's much longer than the 180 days of exclusivity that Congress created as an incentive. The delay means higher costs for patients and the healthcare system. Why does this happen? According to Secretary Azar, there are times when the applications are deficient, the applicant filed before they're really ready, and manufacturers haven't fixed their application. There might be other times when manufacturers struck a deal with the brand manufacturers to refrain from moving to the market. While some at our hearing pointed out the FDA can already revoke exclusivity under certain circumstances, the agency itself has says these forfeiture events have loopholes, and one of our witnesses went so far as to say it was actually completely toothless. The agency and I agreed that we need to move forward in a more streamlined fashion. That's what we're doing here today. We've taken a very tailored approach to fixing this problem in the Blocking Act, and it's estimated it could save as much as $1.8 billion. Under my bill, the 180 days would begin to run as soon as the generic manufacturer is ready, or after a minimum of 30 months have passed and all patent litigation has been fully resolved, when a subsequent generic applicant is ready for approval and only a first filer's parked exclusivity is blocking the next generic. I want to be clear, these criteria are narrowly tailored to tackle this very specific problem. First filers will still have that 30 months to make sure they fix any deficiencies with their application. The bill does indeed preserve the incentives and make sure they're aligned to actually help the patients at the end of the day while generating savings to the system. Generic drugs don't save any money for anybody if they're not on the market. This bill ensures that we have adequate competition and patients have access to affordable medicines. It has the support of the administration, it has bipartisan support on the committee, and should become law. I urge my colleagues to support this bill so we can get more affordable drugs onto the market as soon as possible. And I yield back.